that calls for a mask mandate, saying that you trust Iowans to do the right thing, but some of your own state agencies, DIA, IWD, Alcoholic Beverages Division, have documented instances of business owners and even medical professionals ignoring some of the advice and recommendations that have gone out. So given the threat that those folks pose to the rest of the population in Iowa, do you still think it's a good idea to just trust Iowans to do the right thing?
I do. I have confidence in Iowans. We have processes in place. We are monitoring our businesses and our healthcare facilities to make sure that they're doing the infectious control practices, to make sure that our businesses are adhering, if it's a restaurant or a bar, to the regulations that we have in place. If not, they'll get a warning, and if they don't change what they're doing, then there's a procedure in place to administer a fine, and eventually they could be shut down for so many days. So we're continuing. Businesses have the opportunity to implement wearing a mask as you enter into the businesses, and you see several of them that do that. Iowans are adhering to that. There are individuals that can't wear a mask because of health reasons. So we're going to continue to talk about it. We're going to continue to talk about the importance I have from the very beginning, and we're going to continue to highlight that.
10 people dying every day, so talking isn't working. I mean,
well,
as a lot of people would observe, we've had 250 people die
and you know
in the last
what?
month
Do you want to talk
alone.
about the people that are dying because they've delayed care? Do you want to talk about the suicides that have ticked up? Do you want to talk about the kids that aren't in school?
More to stop this.
We
That's
are
what we're
doing
talking about.
a lot, and I'm proud of what we're doing. And you know what? Any death is one too many, and it's heart-wrenching to see the numbers. But I have to balance a lot, and we've got a great team that's working together and working with Iowans and businesses across this state. But there's more than just one side of this. There's a lot of things that we have to take into consideration when we're talking about COVID. And it is the impact, the isolation, it is the mental health and increase in behavioral health. It is the increase in health conditions because people are afraid to go to the hospital. It's the domestic abuse. It's kids that haven't had any eyes on them for now 7 months that are falling through the cracks. You know, it's moms, dads, single moms that are working 3 jobs because they have to go to work. They have to be able to do what they can to provide a living for their family and try to keep their home and keep their kids educated. So it's all of that. It's just all of it. And we have to figure out a balance that not only protects the lives and the livelihoods of Iowans.
Governor, hospitalization rates